Hi, everyone. I'm Dr. Patti Farris. I'm a board-certified dermatologist, and I'm your host for this episode of Skincare Confidential. As you all know by now, this is an outreach of our medical meeting, the Science of Skin Summit. We're very excited. This year's summit's going to be held in Austin, Texas. It's on September the 5th through the 7th. I get a little confused because we keep jumping from November to September. Now we're back to September. Anyway, it's the weekend after Labor Day. If anybody's interested in taking a deeper dive into skincare and some of the latest trends that are happening in the science of skin, for example, longevity and regenerative medicine, we've got all kinds of really exciting sessions this year. So today I'm really excited about this podcast because, you know, Merrick, I'll just go straight up and be as honest and candid as I can. It's very unusual for me to talk about a subject that I really know very little about. So I always learn a lot from these podcasts, but I think today I'm particularly going to learn a lot because we're going to be discussing the subject of human trafficking, which is something that as doctors and as dermatologists, I think we don't know enough about. But I want to start by introducing my audience to Merrick Elias, who I just met not long ago in an advisory board, and we had a great time working together. He's a board-certified dermatologist, a clinical assistant professor at Nova Southeastern University College of Osteopathic Medicine, as well as the Orlando College of Osteopathic Medicine. He's a volunteer associate professor in cutaneous surgery at the University of Miami. So he's Miami-based. He's a Florida guy. He loves all sports. I can tell you that. I've only spent a little time with him, but he's definitely a sports enthusiast. But he got his degree at Cornell University, his bachelor's that is, and attended the University of Miami, where he did a post-baccalaureate pre-medical program. He then earned his doctor of osteopathy from Nova Southeastern University in Fort Lauderdale. And then he did a fellowship, and it's an interesting fellowship you did in non-invasive diagnostic imaging techniques for pigmented lesions. I'm surprised you didn't end up a Mohs surgeon because you did a lot in cutaneous surgery. You were at Sloan Kettering for some time during that fellowship, and then you trained extensively in dermatology and cutaneous surgery. You're in practice with your brother. You have, which is really cool. You guys have a practice, the Elias brothers, called Elias Dermatology, and they're very passionate, not to mention about everything in dermatology, but about raising awareness with skin cancer as well as sun protection. So with that, I'm going to open up by asking the question, how did you become interested in human trafficking? Is that something you might have seen in your practice?
So first, let me say thank you for that great introduction. Thanks for having me on this great podcast. I'm going to give another plug to the conference in Austin because it's a great conference. I've heard a lot about it. I spent some time recently with your colleague, Ted Lane, and he was giving me a kind of heads up on all the lectures, all the innovative topics. We talked a lot about secretomes and exosomes and some of the other things. But today we are going to talk about human trafficking. And it's something, believe it or not, when I did my research on this, that we all see every day, and most of us don't know it. So it's a hugely important topic. It's something that we need to raise awareness, not just in the house of medicine, but even as dermatologists, as we'll talk about. And it's scary how prevalent this is and how little we discuss it. You mentioned, pigmented lesions and Mohs surgery, aesthetic products. All those are important, but we also have to remember the person who's in front of us. So that person may be going through God knows what. And we'll dive in a minute here.
Yeah. So, you bring up such a great point. We tend to sometimes look at the patient as the disease or as the condition that we're treating and sometimes miss the big picture. How does it happen, trafficking? Let's start sort of at the experience of the person who's being trafficked.
So, we talk about trafficking, we can break it down. And this is really going to be a synopsis of a bigger lecture, really could be even a symposium. There's so many components to it. Trafficking, we think about, under the umbrella of human trafficking, there's child trafficking, there's actual labor trafficking, there's sex trafficking. So, when you see a patient who's a landscaper, they may be being trafficked. When you see a housekeeper, they may be being trafficked. It's not just the traditional, you think of a homeless child or runaway. The first thing we want to do is we want to be able to identify who are these patients, who are these people in front of us. There have been studies done that show trafficking victims, and the ones that have been recovered and saved, and they go through and they ask them, and 80 to 90% of them say they've seen a physician in the last year.
Oh,
Over
wow.
60% of them were seen in emergency rooms. And when you poll the physicians and the ancillary practitioners in emergency rooms and doctors' offices, somewhere between only 10 and 20% say they've even ever seen a patient with that. So there's a huge, huge gap there, a gap in knowledge, a gap in awareness. Before we even talk about how we're going to help these patients, we don't even realize that almost every day we see them. Traffic has been reported in every single state in the country. When I flew to Nashville, recently, the airport in Fort Lauderdale, they have trafficking information in the
Right.
bathrooms. The PA says it on the overhead speakers. I was in Miami airport for an international flight recently, same thing. So they're doing a good job in the airports, but in the House of Medicine, I don't think we're doing that good of a job.
So how does it happen? I
So
know there's some,
there's
yeah,
acts, right? So
steps.
there's very
Right.
specific steps, right? So there's the act, right? So am I gonna, get you? Am I gonna transport you? Am I gonna hide you? Am I gonna promise you things? Am I gonna say that your life will be better? Or am I gonna threaten you? Am I gonna take you and say I'm gonna kidnap you? Am I, all these different things. So then there's that. That's the means. And then the end point is, okay, what's the purpose? Am I exploiting you sexually? Am I, harvesting your organs? Am I making you into slave labor? Am I putting you into work? So, when we find the situation, it could be anyone. You could be down on your luck. You could be working in an adult entertainment club. You could be on the streets. You could be looking for a job, and the person ahead of you exerts some kind of power, some kind of authority over you. They make these promises that you either fall for, or they forcibly execute those promises and take you. And then, it's very hard when these people get into this situation. They don't know what to do. They don't know how to get out of it. Nobody's trained this. We don't learn about it in high
Mhm.
school. We don't learn about it in elementary school. Our parents generally don't talk to us about what would happen if. So, we want to raise awareness, not just as physicians, but as parents too.
Yeah, absolutely. So when when these patients, or I should say these people, are trafficked, they can be trafficked obviously with the number of goals in mind from the person who's doing the trafficking. How do they end up in the emergency room? How that obviously seems to be a place where they're going, the possibility for intervention is high.
Right. So let's say an individual was taken from a truck stop or a massage parlor or one of those facilities. They they're in the life, as they like to call it, right? And they're going through it. But at some point, there's evidence of it could be bruising if it's a sexual trafficking. There could be genital bruising. There could be well visits. There could be acne. We want to talk about dermatology. If
Mhm.
this is a person being put into the sex trade, we think about cosmetic dermatology to make people beautiful, but there's also making people beautiful for an ulterior motive. The business means if there's a pimp or somebody like that, they're going to make sure if they're a little bit older, maybe they need a little Botox, maybe they need to have filler, maybe they have bad acne, maybe they have an STI. So all these are
Right.
reasons they would report to an emergency room. When they come to the emergency room, oftentimes they don't have insurance, or there's somebody who's paying cash. This is one of the ways to tip things off. Now, we have a
Right.
lot of patients that pay cash, right? But someone who comes with maybe an older gentleman, it's a younger female, she's not allowed to speak. Maybe if someone has two, three cell phones with them, they're very vague about their address, where do they live, what kind of, they're not answering questions. They just want to be paid. And typically, the person who's the captor, if you will, doesn't separate from the patient or the victim. So that's
Right.
an important thing we'll talk about a little bit later on, how to separate them. What means once you've potentially identified this, how do we then say, okay, we have to break them apart? And it might not be the first visit. These
Right.
these victims will go back. They'll have vaginal bleeding, or they'll have a sore or an ulcer, or they have a cracked rib because they got hit, or they got
Mhm.
violently thrown to the ground. They have a concussion. So there's a lot of reasons why they would present to an emergency room, but there's also a lot of reasons they present to almost anybody: gynecologists, primary care, dentists.
Sure.
So the whole house of medicine, and obviously dermatology. There's a lot of tattooing that goes on, so we can talk about that as well.
Yeah, I
More
saw some of
com
the pictures from your lecture. Those were so interesting. So, talk about obviously, we do lots of tattoo removal. Are there things in tattoos that might tip us off as to those being related to trafficking?
So absolutely. I mean, these are some of the things, we talk about the physical signs. We talk about the emotional signs. So a patient is down on their luck, their eye contact is kind of like this. They have signs of abuse or neglect. Maybe you look at them and like they have six hotel keys, attached to their wallet or their purse. They talk in a certain manner. They're either talking really fast like this, or they're very glum like this. They'll talk about their time. I used the word earlier. It's in their life. It's just our way. Hypersexualized 11-year-old, is all that. But then we talk about the age groups. We say females 18 to 20 are probably the most common, but we see all age groups, all genders, every single person, male, female, young, old, is at risk and can be trafficked and do get trafficked. So the tattoo signs are often possessive signs. It could be a barcode on the back of the neck. It could be the name of their captor inside their lip tattooed. The biggest one are crowns. She's mine,
Oh,
he's my daddy, the idea of his and hers tattoos, all these signs of possession. So I always implore any of my colleagues, cosmetic surgeons, dermatologists, even our spa owners, anybody that does laser tattoo removal, do these for free. If you see a victim or someone who was a victim of being in the life, just do it for free. Just take care of them, help them feel a sense of
right.
normalcy. You are doing such a huge, important thing for that patient population, and no good deed goes unpunished. So, um, think
Yes,
about that.
it's really, you have to have your antenna up. I do think the ASDS has a program where they provide free care for people who are interested in having tattoo removal. So that's certainly
And
something that I think is a great idea.
even more awareness is a lot of times we talk about, hey, I just bought a new tattoo laser. And who do you market to? The tattoo parlors. Well, when you're in there, we should also
Right.
educate them on if someone comes in with a man paying cash the same way, the same story, right? With a younger girl, and they want this kind of a tattoo. And they're pretty elaborate. It's not just like a little, like I drew it with a pen or a tattoo
I
pen.
know.
These are
I saw
elaborate
the
tattoos.
ones. Yes.
So somebody
So they
has to
take
know
them
what
to
they're doing.
professionals to get them done,
Possibly, or maybe they have an in-house person who's tied to the whole scheme,
to the whole
but
organization.
to the whole organization, whether it be organized crime or other facilities. It could there could be so many ways that this can happen. But if the tattoo parlors are aware, anybody that does the tattoo removals are aware. We do full body skin exams. We check our patients everywhere. You can see these signs. Sometimes it could be a little shotgun behind the ear, and you think nothing of it. Ask the patient. A patient who is being trafficked will never be upset if you ask. And a patient who isn't, and I've done this myself because I've seen crown tattoos and they're like, no, no, that's just me and my husband. It says his and hers, or I'm his, um, and they say to me, thank you for asking. I'm safe. I'm okay. But I'm glad you
Yeah.
asked. They're never going to be mad at you because you're looking out for them. And when they realize it in that context, they say, wow, and then you end up opening the dialogue with them.
Hi, it's Patty. I hope you're enjoying this episode. And this is just a reminder that the Science of Skin Summit will be held in Austin, Texas, September 5th through the 7th. Go to our website, scienceofskinsummit.com, and the registration is open and the agenda is there. We'd love to see you there. I would think today, especially with social media and the internet, it's just, I mean, it's petrifying, quite frankly, because it's young people have so much access to strangers, which, when we were growing up, it just wasn't that way. But now, I mean, it petrifies me, honestly, especially social media, because I know there's lots of predators out there. And we've all heard these stories of especially young women getting involved with people who just do not have good intentions. What, from a dermatologist standpoint, so you mentioned tattooing, are there other signs or things that we might want to be aware of? I would think STDs, and as dermatologists, we're certainly on the forefront of that.
Absolutely. I mean, there's basic things, right? You could be malnourished looking, right? You
Right.
can ask them, you or your staff in your history. We should all be asking our patients. We tend to think of this with our elderly patients. Are you safe at home? Where do you live? Are you eating? What kind of work do you do? Are you ever left alone? You can frame certain questions that can give you a hint.
Right.
And depending upon the answer, if the person is with their captor, their body language might tell you because they're not answering, or they may do this
Right.
and they look like this. What should I say? Or the other person will speak for them. Oh, they work for me. I own a dry cleaning business. I own a cleaning business. Some front. We clean houses. I'm a landscaper. I'm a roofer. Like I said, we think of this for just young girls, but it's everybody. And
I'm
patients
sure.
and people that come to our country that don't speak the language, they're from another country, they're at risk. If they start talking about, and I know this is a little controversial these days, but in the past they used to say, if a patient starts worrying about being deported, I'm afraid if you're going to tell me, I'm telling you something that you're going to call somebody. Like, all those are signs. Especially if
Hmm.
if you fill in the rest of the blanks, these are all things that you worry about. The submission behavior, drug addiction. We see patients that are
Yeah.
drug addicts, right? Some of them admit, they say, "Oh, I vape a cigarette, I vape tobacco, I smoke a cigarette," but others will admit to other drugs or a history of drug abuse. A 13-year-old with drug abuse, with tattoos, that's there with
Yeah.
a man that's not her father, like, flags should be going up.
Right. Wow. It's pretty powerful. I knew this would be a very interesting subject because, like I said, it's something that's really not on my radar. I would think being in a port town, which is where I live, and you're also in a port town, we probably would even have a higher incidence or a higher possibility of running into one of these patients in our practices where they're coming in and out of, various areas. We have certainly a lot of transition and people coming in and out of port towns.
Right. Look, in New Orleans, Miami, these areas where they host the Super Bowl and large events,
Yep,
it's possible. There's an uptick during that time, um,
absolutely.
tied to prostitution and sex rings, but all sorts of trafficking can happen. Like you said, cruise ships, ports are easy access in and
Hmm.
out. I recently read a story about a girl who was actually abducted on a cruise ship. She went out, and like her phone and everything was left. This was maybe 10, 15 years ago, a pretty famous story that I just hadn't heard of. And they were looking for her. They asked the cruise line, can you not let anybody off the ship? When they docked, the cruise ship said no. And you have to swipe out. So theoretically, they should have been able to track. The person
Right.
was never found. That they were, oh, she went overboard, this and that. Years later, people started sending pictures to the parents. This is your daughter. We see her in a sex um, factory. We see her in a strip club,
Oh,
an adult entertainment. And, they never were able to put it together, and it's still an open case. So the cruise ship one is a huge one. Mardi Gras, big events, right?
yes.
Rose Bowl parade in California.
Yeah.
We can pick anything in any city. Um, but these are things that happen everywhere, but especially when there's big crowds. Disney World, Disneyland, amusement
Can
parks, they can
imagine.
snatch a kid very quickly there. So, we want to be very careful as parents. We want to be careful if we see anything nefarious happening. But then we also say, like, what do we do to help these patients? What do we do when you're sitting in front of me? I've identified that you may be a victim. What do I do? What would you do, Patty?
Well, I was going to say, I mean, we're all very attuned to child protection, to signs of child abuse, and we know that we are obligated by law to report child to child protection. And I've had to do it twice in my career where I 100% knew I had to call. And so I'm assuming that there is some place to notify if you have somebody you think is trafficked. Is it something similar where there's a number and a
Right.
organization that you can go to? So what
Sure,
is
there
that?
is.
I don't know what it is,
So
Merrick.
I'll talk about that in a second, but here's the thing. Think of the timing. Even if you called 911, what are you doing to keep the
Yeah.
patient there?
Yeah,
Right?
exactly.
That
Yeah,
patient's
they're
already in the
going out
wind
the door. Yeah.
by the time they show up.
By the time you
So,
notify.
right. So one of the techniques, besides asking some good leading questions and trying to identify, sometimes if it's a young female, try to get something simple like a urine test where she can go to the bathroom and you can separate the two, separate
Oh,
her from the captor, right? Ask the captor, hey, there's some extra paperwork in the front, but have things. So I'm gonna flash it up. It's part of my presentation. I printed this out
so
from my lecture. I don't know if it'll be visible, but this is a
we'll see.
sign right here. I don't know if we can see it, that looks like when you're in college and you're looking to rent a room or rent an apartment, they have those little tabs with the tear off sheets. So I'm going to read what this one says. It says, scared to go home, need help, and we will help you. And it has it in different languages. And it says, tear off the sheet, give to one of our staff members discreetly.
Oh.
They'll know what to do. So if this is in a restroom, if this is even in a patient room, you could have it in your lobby, and they don't run out, because if the captor doesn't see this and makes, say, I don't want to be here, it's a dangerous spot for them. And they tear off a sheet and just slip it in your MA's pocket. You hand it to your check-in girl. Now we already know there's a situation. So if they somehow can alert you, then you have time if you did want to call 911, but 911 may not be the right choice. But you have the option to delay them, to try to get more information. This person's in trouble. Sometimes you just need to make them follow up. Hey, you're not going to get it done this visit, but let them know they're safe. Write it on a prescription pad, old school. Please follow up in 2 weeks. We need to see you back. Let the captain know you need to bring her back. So now you have a window of time to try to help them, assuming they come back.
Right.
In the emergency room, what happens is they get dispositioned and they get sent back out. They get treated, they get a shot of IV antibiotics, or they get referred to see somebody and they're gone. But for us, we have a little more time with them, right? So most of us do isotretinoin and iPledge and have urine tests. So that's a very simple way
it's
to do it.
An easy way to separate them.
Right? If it's a
smart.
tattoo thing and you say, hey, I see the tattoos, can I do a skin check? Sometimes skin cancers hide in tattoos. You can buy time, right? Most of us, we try to rush out of the rooms, right? You see a patient, you want to get to the next patient. These are the patients you slow down for. You give yourself more time, ask some more questions. I think you told me you don't smoke, but that was tobacco. What about marijuana? You can ask questions that give you information, but stall. And you can see that the other guy's going to start getting like this, start getting a little fidgety, start tapping. You start getting nervous. He's busting out 3 cell phones. We got to go. Can we, I have another appointment to get to. Can we go? That's going to be a hint. And at that point, even if you can't do anything else, make the follow-up appointment. Now, there's another slide. I printed out a couple of my things here because this is from a lecture, so I got to find it because we talk about the hotline. So this one here is the number you can call here. I don't know if it'll show.
Yeah,
it's the National Human Trafficking Hotline. It's 1-888-37-37-888, or you text Be Free, which is 23337, right?
Right,
23337.
I can see it.
So that's the Human Trafficking Hotline. There'll be a little more of assistance than 911. Now, another hotline is 988. That's the suicide depression hotline. Sometimes these patients are overlapping, right? They're going to talk to you. They're going to say, I feel like I want to kill myself. Or maybe you're thinking about putting them on Accutane, or you're putting them on a biologic medication because they have psoriasis randomly. And you ask that question, they may say, I'm suicidal or something. So you want to get the help from the hotlines that are available to us. So that's really important. And then there's some other things, but I want to get to. I don't know where we're doing on time. But
I was going to say we're getting close. So, to wrap it up, why don't you give us sort of some take-home points that we can.
So, one of the things I want to talk about that I always like to end my talk with is the hand positioning. And we've seen these stories on TikTok and YouTube and all social media of someone who's been kidnapped and they're in the back seat of a car. And they do the hand signal. And if you know what the hand signal is, to call 911, to save them, to maybe to follow them at a safe distance. So what we always say is, and I've taught my children this, I teach patients this, I taught my staff this. Obviously, we employ some, women in their 20s and 30s, so we want them to be safe. We don't want them to be victims either. So the more people we know, it's simple. It's like this. You fold your thumb and then you cross. When I give the talk, towards the end of the lecture, I make everybody do it like 3-4 times so they know how to do it. If you see that when you're driving, you might save somebody's life, whether it be 911 or one of the hotlines. But if you're a victim and you're pushed up against a window, you're being pulled out of a supermarket, you're being chased down, try to do the hand signal. Someone may know what that means and be able to save you.
That's great. This was really super interesting. I've got to catch your lecture next time you give it. I think this is, again, such valuable information, something we don't know near enough about. And I really appreciate you spending the time to talk to me today. Thanks, everybody. I hope you enjoyed this episode. and we'll see you all next time.